Ever ponder the importance of media on our mental health? You're about to find out in today's episode. I'm your host, Jeff Udick, and I'm thrilled to bring you an engaging conversation with Dr. Laura Erickson-Schroth. Laura is a key member of the Jed Foundation, focusing on safeguarding the emotional well-being and preventing suicide among teens and young adults. In our discussion, pay special attention to these two key points. First, how media literacy can empower young people to critically analyze the content they consume and its effect on their mental health. Second, the way in which storytelling in TV and film can be a powerful tool for shaping identity and coping mechanisms in youth. Before we dive into this insightful conversation, I want to take a moment to thank our episode sponsor, MoneyPickle.com. Educators, it's never too late to get savvy with personal finance. Money Pickle offers a fantastic opportunity for you to consult experienced financial advisors for free. These Pickle Pros are there to simplify complex financial concepts, making them easier for you to grasp and master. Empower yourself with financial knowledge, all thanks to MoneyPickle.com. Head over to MoneyPickle.com/shiftingschools to start your financial learning journey. With that, prepare to dive deep into our conversation with Dr. Laura about the significant role of media in influencing mental health. It's going to be an insightful journey. And with that, on with the show. It's so great and an honor to be joined by Dr. Laura Erickson-Schroth from the Jed Foundation. Just to remind people, the Jed Foundation is a nonprofit that protects emotional health and prevents suicide for our nation's teens and young adults, giving them the skills and support they need to thrive today and tomorrow. Laura, you are here to talk about how that work links to media literacy and our representation in TV and film. Let's get started by talking about what kind of effects do you think entertainment can have on young people's identity and mental health?
Yeah, first of all, Jeff, thank you so much for having us on this show. I'm really excited to be here to talk about this topic with you because I think media can have such a tremendous effect on young people. You know, storytelling is how people have been passing along information for all of human history. So we know that it's effective. It's how we pass things on for generations because it's so engaging. And I think specifically around mental health, it can do a few different things. You know, one is reduce shame, prejudice, secrecy, by talking about mental health accurately and openly. It can encourage more compassion and understanding for when people are going through things. Can help change narratives that aren't helpful about mental health. Things like mental health being only about struggle, when really mental health is a continuum from struggling to thriving. It's part of all of our lives. Media depictions can inspire young people, can model ways that they can be proactive about their mental health, ways that they can care for each other, and ways that adults can be there to support them and they can be there to support each other. So, seeing a character on TV struggle with a mental health issue or have suicidal thoughts, that can allow young people to understand what they may be feeling and find a name for it. And responsible storytelling can also show a viewer it's okay to talk about things like suicide. We know that data tells us talking directly about suicide, asking someone if they're thinking about suicide can actually bring relief and increase the likelihood that they're going to seek out help. And then dialogues on TV or in movies can really show parents, other adults, also young people, how they can initiate difficult conversations. And positive stories can provide hope. So stories have the power to show young people suicide is preventable. There are resources that are available. They're not alone. And storytelling, actually, I think the other thing that's really important is that it can increase positive representation for young people, and that boosts their mental health. So LGBTQ youth, youth of color who historically haven't seen themselves authentically represented. I'll give an example, which is that we did a panel with the TV Academy in the spring, and one of the panelists was Nupur Agarwal, and she's the SVP of Social Impact at MTV. And she talked about watching the show Never Have I Ever. Have you seen that show? She said she realized that before before that show, she'd never seen a Southeast Asian woman in therapy on a TV show or in a movie, and how much that meant for her and how much it would have meant for her as a teenager to see that. So I think the power of storytelling is its ability to push people to think differently. And that's why Jed has been working with the entertainment industry. I think it's now for over 17 years. And we work in the media space in a couple different ways. One is we produce campaigns and educational videos ourselves or in partnerships. And the other is we work with the entertainment industry to improve depictions of youth mental health. That's through something called our Storytelling and Culture Change Initiative. So in terms of the content creation, we produce educational videos. We have a partnership with YouTube where we're producing videos about depression, about alcohol use, opiates, eating disorders, PTSD, OCD. We have a campaign called Seize the Awkward, which is a joint effort with the American Foundation for Suicide Prevention in collaboration with the Ad Council that helps young people to have the tools to have conversations to support each other. And the most recent PSA from that is with Megan Thee Stallion. And she talks about, how it's okay to not be okay and how she gives and receives support from her friends. And then, we also work to help change the entertainment industry and how they depict mental health. So we provide, expert consultation to entertainment creators to help them tell, accurate, compelling, diverse stories. We have partnerships with groups like MTV Paramount, with Spotify, with CAA, USC's Annenberg and Center for Scholars and Storytellers. We're a founding member of the Mental Health Storytelling Coalition. And one of the lead authors on what's called the Mental Health Media Guide, which is actually a really great resource for entertainment professionals to learn how to tell authentic stories about mental health.
That's fantastic. Is there anything, I just think about teens today, and I do a lot of work with school districts around teens and social media. Is there any play into this idea of storytelling? I think is fantastic. And I think we a lot of times overlook social media as also storytelling in ways that it can be. Specifically today, we have a lot of teens that are hanging out in Instagram with Instagram Reels or Shorts on YouTube, as you mentioned, but also in places like TikTok. Are you doing anything in there to get these stories out, in front of kids where kids are? I think it's one thing when we talk about, full-length films and things like Never Have I Ever that are on television is one way, but the short form content, are you finding any impact in that space?
Yeah, I'm so glad you asked about that, because that's one of the areas that, we love to sort of get involved with. So, we provide direct support for entertainers like actors and musicians, but also for influencers, to help them explore how do they want to engage around mental health? How do they want to tell their stories, respond to fans who might be reaching out to them? Because actually they receive a lot of messages, especially from young people who are going through difficult times, and they're not always sure how to respond to them. So we can help them to figure out how to get young people to resources. We had a collaboration also in the spring with Snap, where we did an event with them and provided influencers that work with them information on how to talk about, mental health in ways that's the most effective and most helpful.
I love that. What are some misconceptions about mental health that you see frequently play out in film and TV? And what can we do to better address those misconceptions?
Yeah, I think sort of taking a step backwards and looking at the big picture, I think we're not seeing mental health enough in film and TV. I think the way that it affects us in real life isn't what we're seeing. So, if you look at the research, over 20% of Americans are experiencing some sort of mental health condition. But according to, there's a report from Annenberg at USC that they put out where they look at the top films coming out each year. And you can see in that report that only 2% of characters across the top films in the last year had a mental health condition. And that's a big gap. Of that small percentage of characters, about half of them are showing mental health conditions in ways that dehumanize them, trivialize the issue. There are a lot of, characters' conditions that are used as the butt of a joke. something that you're going to hide from your friends or family. And I think there are a lot of potential opportunities there to address, you could have the protagonist have a mental health condition that they can manage, that we're showing them manage, increasing visibility, again, of particular groups of young people, showing that culturally competent care can be available. And then I think there are misconceptions about particular things that come out very often. And I think the two most common that I see are violence and suicidality. In terms of violence, there's this misconception that people with mental health conditions are perpetrators of violence. And again, you can look at Annenberg's study, and over 70% of characters with mental health issues shown in the top films over the past year were perpetrators of violence. Over 70%, and we know from research that people with serious mental illness are much more likely to be victims than perpetrators of violence. But that's not what we're seeing, in film and on TV. I worked in psychiatric emergency rooms for many years, and I saw, thousands of patients that had psychosis, which is probably the type of mental health condition the public is most afraid of. And I think it's because there's mystery around it and people aren't really sure what the symptoms are, but once you get to know people with psychosis, you understand that, almost all of them are struggling to kind of make sense of reality, and they're really not looking to harm anyone. And they're often more scared of what other people are going to do to them. And like I said, the research shows that they're much more likely to be victimized. And then I would say the other big topic is suicide. So, again, like I said earlier, the idea that if you talk about suicide, it's going to give someone ideas, right? Or make them think about suicide when they hadn't been thinking about it before. But in reality, talking about suicide and bringing it up with someone who is having suicidal thoughts actually typically provides relief and encourages them to reach out for help. So there are a lot of ways that suicide is depicted in film and TV that I think could be improved. I think it's important, for example, not to talk in detail about like the method of suicide. There is evidence that can trigger people who are thinking about it if you depict it on TV. The other thing is romanticizing it. A lot of times, people think from watching TV and film that once you die by suicide, people are going to pay more attention to you, or that there's some kind of like glory in it. Another thing that comes up is suggesting that if someone wants to die, there's no way to change their mind, that it's kind of inevitable. We often see that kind of shown in film and TV, but actually in reality, most people are ambivalent. Most people have reasons to live and have reasons that they're thinking about dying. And most suicides are impulsive. Suicidal crises can be really short-lived and people can get through it. It can escalate quickly. But then, once you get through it, if you're able to get through it and you have help, 90% of people, even who've had a serious suicide attempt, don't go on, to die by suicide later. Another common one that comes up is showing suicide as selfish, something that someone does to hurt other people, when really people who are thinking about suicide often kind of go into tunnel vision. And what they're really thinking about is, that they're a burden to other people, that they might be better off, other people might be better off if they weren't around. So there are a lot of these kinds of stereotypes around suicide. And I think, overall, we need to push the message that, mental health is this continuum, like I said, from struggling to thriving. And a lot of times it's depicted as either someone has this, very serious mental health condition or everything's fine, when really, so many of us go through mental health issues, and it's a normal part of life.
I love that. Talk a little bit more on kind of a bigger scale of the work that Jed does. We've been focused very much on media literacy and the media side. But let's just take a moment and pause here and just talk about what is the work that Jed does. And for a K-12 educator listening to this, how can a foundation like Jed support that?
Absolutely. So Jed was founded by a couple, Phil and Donna Satow, who lost their son Jed to suicide while he was in college. And so what they did was they went to the president of the college and they said, our son died by suicide and we want to help prevent other students from dying by suicide. What kind of programs or policies do you have in place? What can you do? And the president said, I'm actually not sure. There's nothing in place for us to go to. There's no sort of rubric to use. And that's how the Jed Foundation came about. So we started initially working with colleges. And now we've worked with over 500 colleges across the United States. A quarter of U.S. college students are attending what we call a Jed campus. And we also now over the past few years have developed a high school program. And we're starting a district level program. So we have 18 districts that are starting a pilot program with us. This year, and we're looking at things on a systematic level. We're starting to think about how do you make changes from a district level that are going to affect young people and improve their mental health and decrease the likelihood that they're going to die by suicide. And the way that we do that is using what we call our comprehensive approach. So this is based in research where we've looked into what are all of the sort of target areas that research shows us can positively affect youth mental health and prevent suicide. And so what we do is we go into a school, we meet with a team that they've created. And first we do surveys of the students, we gather important information from the administrators, and we figure out where are they starting from. And then we help them to put together a strategic plan that they can follow. And we work with colleges for 4 years and we work with high schools for 3 years to, once we've identified those areas in that strategic plan, to help them to figure out how to, carry that out.
Wow. That's so great. I love that. I love that we're getting support, especially for high school. I think it's a great place to start. I mean, we know we need the support K-12. And I love that you're starting to roll out a district level support of looking at, the whole child from the moment that they come into our care within, public education or inside our schools. How are we supporting kids with their mental health, through life? I mean, because we know that, educators in a school district can see, you get 12, 13 years with a child. There's a lot of impact that you can have on a student's life as well. For our listeners who want to perhaps point students or families to media that has a positive representation of mental health, can you give us some examples or two and maybe tell us what you are looking for in positive mental health representation inside of media?
Yeah, I have a few favorite shows. So, I'll mention a couple of and things that I'm seeing in those shows that I really love. So one show that I'll bring up is called Wolfpack. And actually, our senior media consultant, Courtney Knowles, was advising on this show as they were developing it. It's this supernatural show, where the world is kind of falling apart. And so you wouldn't necessarily expect that would be the place where you would see sort of these great depictions of youth mental health. But I think it does a couple of really good things. One is it shows a teen boy with an anxiety disorder. And most often it's girls that are depicted with anxiety disorders. And so I think it normalizes that. And then it sort of also demonstrates on screen for young people that there are skills they can use to manage their anxiety. So there's this great scene where the main character, his name is Everett. He teaches one of the other characters named Blake how to do this thing called lion's breath, which is this breathing technique that helps with anxiety and to cope. And it's a fun scene because she's, he says it's lion's breath. It comes from yoga. And she says yoga, you want me to do yoga when the world is falling apart? And then she tries it and she finds it so helpful and she does it again later. So I think, sort of creating these depictions and then, there's memes going around that people are sending around about her doing lion's breath and kids sending them between each other. Another show I love is Never Have I Ever, which I already mentioned, but I love that it's a show where these characters aren't just stereotypes. They're young people that come from all these different backgrounds, and they're engaging in talking about mental health the main character is, Southeast Asian girl who's in therapy with a Black therapist who's a really good therapist, which is important because we see these trends in youth shows depicting health professionals as out of touch or unable to help them. And we really need to create those depictions of, wow, you really could find someone who could sort of be there for you. And then the last show I'll mention is Heartstopper. I'm completely in love with this show. I can't talk about it enough. I think what I like most about it is that it takes all of these tropes about, what you need to do to make a show entertaining, and it kind of turns them all on their head. And it shows us that, real human connection can be just as exciting as these sort of contrived scenarios. So, almost every show has a scene where someone, has a misunderstanding with someone else. And the whole episode is about them, you're kind of like screaming at the screen, like, just talk to each other, right? and in this show, they actually talk to each other. Which I love, and they do that while they're talking about like these two high school boys who meet and they fall in love with each other. One of them's getting bullied. The other one's like the captain of the rugby team because this is taking place in the UK. And they show, accurate depictions of things like eating disorders. One of the boys has an eating disorder, accurate depictions of bullying and how that affects a young person. So I think there are shows that really get things right. And the more of this kind of work we all do, the more I think we're going to see that. And we're going to have like, a real lasting impact on young people and how they think about mental health.
I love that. I love that. I can tell you're passionate about the work you do. What's it like working for an organization like Jed that's making such a positive impact in the world, and especially with our youth today?
Yeah, I find it so fun. You can hear it in my voice. You can see it because we can see each other. I just think it's so interesting to be able to take something that, I know about from doing clinical work and apply it to this area where maybe there isn't that much conversation about mental health. And people really invite us in. They want to know what's going on. What happens when a young person has this kind of thing? How do they get connected to help? What is the kind of help? And so it's fun to actually, educate people and make sure they know about this and that it, gets translated into media.
I love that. I love that. If people want to learn more about you, reach out to you, learn more about the Jed Foundation, what are some ways that they can do that?
Yeah, so we're at jedfoundation.org. And if you want to find our storytelling and culture change initiative, it's just jedfoundation.org/jedstorytelling. Anybody who's interested in this field, I would suggest checking out the Mental Health Media Guide. Or also Seize the Awkward. I think especially for young people, the Seize the Awkward campaign is specifically for them to learn how to connect with each other and support each other. So thank you so much for having me.
Yeah, well, thank you for being here. And we will make sure that links to all of that are in the show notes along with your bio so people can reach out to you through the Jed Foundation as well. Dr. Laura, thank you so much for spending time with us today and talking about this and really focusing in on how media can really play a part in students' lives.
Thank you, Jeff.